I have introduced NAM already. NAM, as I said, the main person behind the Diabetes Atlas had a very important job actually in collecting the data and printing the Diabetes Atlas. So it's a good chance actually here to be with a person like Namcho, just to speak about the Diabetes Atlas, what behind numbers, because it's not just the mere numbers, but what behind it. I'm sure Nam will be able to cover that issue very efficiently and very lengthy. Thank you, Nam. Please go ahead.
Thank you, Professor Adel Al-Said. And since we are running behind time, I'll try to briefing each slide instead of going into details. Probably all of you knows that first time this 7th edition was reported in the Vancouver World Diabetes Congress meeting. Beside that, Aswan is the first place actually introducing the 7th edition. So you should be honored that you're receiving our first lecture. So it's behind the numbers actually. You know, you heard a lot of a clinical aspect of diabetes, but where all these people with diabetes coming from? You know, in order for you to become a better clinician, you have to understand patient's background. So this is what's about it. So I'll report the numbers, but important numbers. As we all know, we're dealing with three main types of diabetes. They are type 1, type 2, and gestational diabetes. But poorly managed diabetes leads to serious complication and early death. With good self-management and health professional support, people with diabetes can live longer and healthy life. Very simple as that. But here's the fact. This is the summary slide of Diabetes Atlas indicating where all this number falls in each region, which is all of you know IDF consists of 7 different regions. So your region is right here, Middle East, North America. Currently, we reported 35.4 million people living with diabetes in your region, but that expect to increase 100% by 2040, and counting 72.1 million. So expect to see more patients in 2040 if you still practice by then. But most numbers occurring in Western Pacific region where I'm coming from, totaling about 153 million in 2015, but by 2040 it'll increase as much as 215 million. So, but however, the prevalence is highest prevalence reporting North American and Caribbean region with about 12%, and I'll show you detailed slide in coming slides. So anyway, in total, we counted 415 million people with diabetes living in the whole world in 2015. But that expect to increase as high as 642 million by 2040, not counting high-risk population such as IFG or IGT. So, for looking at easy ways, right now we have 1 in 11 adults has a diabetes, but that expect to increase 1 in 10 adults by 2040. What about gender differences? This slide depicts that 2040 out of 450 million, 215.2 million is in men, indicating approximately about 52%. Of course, 48% is female, showing that male is more affected by excuse me, with diabetes. By 2040, that number will consistently stay in the same level, but the number will increase almost 330 million in men, about 313 in female. What about in urbanization and diabetes? This slide shows that people living in urban, they have more diabetes, showing with almost 70 million, counting about 65% of total diabetes compared to the rural area. By 2040, that number will increase about 478 million, and then that accounts about 75%. So 3 out of every 4 will live in urban area. Why is that? Because a lot of cities now become urbanized, as well as a lot of people moving into the urban area, and they are more exposing to the urban risk of developing diabetes. So in the future, there will be more diabetes because of urbanization-related issues. If you look at the diabetes in 7 regions and look at the prevalence of diabetes, as you could see in the world, it's about 8 to 9%, and we expect to increase a little bit in 2040. If you look at the Africa region, it's somewhere around the 4%, and whereas in North America, almost 12%, and your region, MENA region, is about 11%, showing the highest in North America, followed by your region. Why is low in the Africa region? Because they are not, diabetes not fully aware. Awareness is not still well in up to stage where we like to see in Africa region, indicating there's more hidden cases in Africa region. So we need to continue to do the diabetes awareness campaign and then continue to identify the hidden cases. But in Western Pacific, we are seeing somewhere around 9%, but number-wise, there is more, about 60% people with diabetes living in Western Pacific region. So this is the MENA region. Prevalence of diabetes, seeing that highest in Saudi Arabia with somewhere around the 20%, and your country follows next, and lowest in Yemen and Algeria area with less than 8%. As you could see, there's a possible relationship with age and prevalence of diabetes in your region. So if you look at specifically in Egypt cases, diabetes 20 to 79 years, and in 2015, total number we estimate is about 7.8 million in Egypt, and that are expected to increase 15.1 million. You're probably wondering, what is this number underneath? This is confidence interval we created this time, first time in Diabetes Atlas edition. So indicating based on the publication we selected from your country, we could estimate it as low as 4 million to as much as 9 million people with diabetes in your country, and that'll increase 7.3 to about 17.3 million in 2040. And world country prevalence shows about 15% at this point, and prevalence again ranges from 70 to 17.1. Probably all of those studies we conducted in your region fall in this group. Okay, so that's what range is indicating. But it indicating increased about 18% by 2040. But the striking news is that diabetes-related expenditures per person in Egypt is now $219, but that remains still $218 by 2040. I don't know what is that indicating. It's because government's not spending enough money to look out for diabetes patients, or the patients not really looking out for their cases. So here's the striking news that you should be fully aware of it. And the number of adults with undiagnosed diabetes in 2015 is about 3.2 million, and that expected again increase about 100% with about 6.22 million by 2040, which indicating about 41% is still not diagnosed with diabetes, even though they have diabetes. Okay, number of deaths due to diabetes in your country is about 78,000 each year. And percent of deaths before age of 60, indicating young, early deaths is about 44%. Probably that shows how good all of you are doing to look out for this patient. I don't want to say how bad. I really like to say how bad, but I'd rather like to say how good you are doing. But we have a lot of areas that we could improve for diabetes management in Egypt. Where Egypt is standing in terms of the number, you're ranking number 8 in whole world. China is number 1 with almost 110 million, China is alone, and India follows the United States, Brazil, Russia, Mexico, Indonesia, and Egypt. But by 2040, you'll one step up, you'll be ranking 7. But look at Japan, they're falling out from this 10 list, so I would love to see that Egypt fall out of this top 10 list also. So you have a lot of work to do in the next 25 years. Another area that I'd like to touch on is that undiagnosed cases, like I indicated in the introduction session, that if we add undiagnosed cases, we'll have a lot of numbers. We add the IGT or high-risk population, we have also a large number that will accumulate as much as 700 million, but I personally think that will reach more than probably 1 billion if you add all that, including gestational diabetes and so on. So anyway, 1 and 2 adults with diabetes are undiagnosed at this point. If you look at the number of people living with diabetes who are undiagnosed by region, most cases in China and in India area with more than 10 million, and the MENA region is right here, and their range is somewhere around 50 to 200 million to as high as about 500 million. So undiagnosed cases, your region is not in good hands, so we still need to diagnose more. So if you look at the by ranking, that Africa shows highest undiagnosed case with about 67%, yielding about 10 million cases. And it is followed by Southeast Asia and Western Pacific. You combine these two, there are more than 100 million people still need to be diagnosed. If you look at the U region, Middle East and North Africa, it's undiagnosed about 41%, yielding almost 15 million people. So in overall world, it's about 46, 1 out of 2, 46.5% still need to diagnose, and which yields almost 200 million cases. So how the number was calculated, you probably see, wow, that's huge numbers we're looking at it, but what is the based on that? What we call the sensitivity analysis. When you say the sensitivity analysis, you have to understand that each country's obesity level and then family history, those risk factors, the percentage of those risk factors, but we cannot do that. We don't have that information for each country. So we only use the data, how it is generated from each country. So we come up with the method that we give the weights in 5 different areas. Method, diagnosis, representation, type of a publication, sample size, age of data sources. For example, if your study was conducted using oral glucose tolerance test, you get more weight. Assume that we give a 1 point for this, but if your study was only using hemoglobin A1C, you probably get like 0.7% point. So you calculate number multiplied by that weight. So that's the same way applied by representation. If it is a nationwide study, you'll get more weight versus group study. If type of publication, peer-reviewed publication, it occurred in journals, whereas personal communication gets less weight to calculate your numbers. Sample size, of course, is greater than 5,000 people based on study, then you get more weight versus the small studies. And age of data means that publication is released before 5 years, less than 5 years, you get more weight versus 20 years or more. So based on this kind of evaluation, you could see how your region is coming up. So here is the countries and territories where data sources were reviewed with information on diabetes and impaired glucose tolerance in this age. Number of data sources were used in your region, especially, it's very difficult to see from this end, and your country is somewhere around the 3 to 5 data resources we collected, and we use those information to calculate the number of, and estimate the number of diabetes cases in Egypt. And again, this is the data sources selected of diabetes estimated in adult, and number of data sources selected it for your countries here. It's one data set. You had the 3 to 5 cases in previous slide, but we screen those 3 to 5 cases, and we select one which gives the best representation of Egypt, and we utilize data to calculate your estimate the number of cases in your country. And if you look at the oral glucose tolerance-based test coming from your country, it's 0 in past 5 years. In this case, we use the database which was available behind the 5 years. So it's a number of data sources selected it, and in Egypt case again, number of data sources selected is 0. So it's you have a 0 publication less than which is recent publication. It's all old publication coming out. So Egypt area, you need to do the more epidemiologic study to get a better estimation of the number of people living with diabetes in Egypt. Also, poorly managed diabetes lead to serious complications and early deaths. Our data shows that 5 million people died from diabetes in 2015, which is equivalent to 1 death every 6 seconds. and I indicated that in 2013-16 edition, our report was the one death every 7 seconds, but the 2015 increased to one death every 6 seconds. So every year, the 5 million people dies from diabetes, which is much greater than combining of 3 areas with 1.5 million with HIV and 1.5 million with the TB and 0.6 million with the malaria. So diabetes more the high-risk populations for death. So diabetes counted for 14.5% of global all-cause mortalities. This among people aged 20 to 79, and 46.6% of deaths were in people under the age of 60, indicating there is a high percentage still occurring in younger age population. So this slide depicts the proportion of people who dies from diabetes before age 60s, and you could see the China and India and most MENA region, their mortality is occurring, young mortality is occurring about 40 to 60%, whereas in North America and Europe, most cases are less than 20 to about 20 to less than 40 to 20 range. If you look at the by countries, Africa show highest the deaths, early deaths, indicating about 80% under age 60 died, and totaling about 321,000. If you see it, highest peak is occurring age 30 to 39. But if we go into